Hello everyone, am I audible and visible? Let me know, then we'll start. Am I audible and visible? Okay, fine. Yes, fine. So, let us start. Hello everyone, I'm myself Dr. Deepthi Karya. I'm MD PhD Physiology and I'm educator for physiology. So today we'll start digestive system. Okay, digestive system series I will be going to start. Fine. So before that, I would like to explain you that you will get notes of all my lectures. You can get soft copy as well as hard copy. For soft copy, you have to download the application Vesalius and you have to subscribe for the same. Okay, link for the same is given in the description box. For hard copy, you can order the book Physiology Notes that is available on the Flipkart as well as on the Amazon. So you can also order the book same, as well as that link is also given in the description box. And we also have practical application that is Practicable. Okay, so that Practicable also you can download for getting information regarding practicals. Okay. Huh. One more announcement. In this channel, I am placing live videos. I am putting live videos for first year MBBS nursing, physiotherapy, and homeopathy students. So if you have anyone in your group, in your friend circle, please share these videos to them, and that will be definitely very much helpful for them. Okay, fine. Now today we'll start digestive system as Ali was eagerly waiting for the same. Okay, so let us start digestive system. So first of all, digestion. What is digestion? Okay, before anything which we are taking, that is getting digested before absorption. So digestion, that is conversion of large, complex and insoluble particles into small, simple and soluble, all three S, small, simple and soluble particles. That is digestion. Okay, so that they can be easily absorbed. Okay, they can easily pass through our digestive tract and it can be easily absorbed from our intestine. So this is a definition of digestion, that is conversion of large, complex and insoluble particles into small, simple and soluble particles. Okay, fine. I will try my best. This is sufficient, I think, Ali. Huh. Now, what is the function of digestive system? Okay, digestive system function, that is one, that is digestion. Means, as I told you, conversion of large, complex, insoluble particles into small, simple, soluble particles. Fine. And second function, that is absorption. This particle, small, simple, soluble, they are absorbed. Third, that is unwanted and unabsorbed particles, they are excreted. So these are the basic functions of digestive system. Fine. Now, so starting with the mouth, this digestive system starts with the mouth. So we are first ingesting food. This is not injection, this is ingestion. Okay, means entry of food through mouth. Okay, so first is we are placing the food in the mouth, then we are chewing the food with the help of our oral cavity, teeth and muscles and all. That is, so first is placing the food, second that is chewing, which is also known as mastication. Okay, third, during chewing saliva is added, saliva addition. Okay, fourth is swallowing, or which is also known as deglutition. Fine. Okay, so these are, then that is followed by entry into the stomach, and after that the food will pass through intestine and all through peristaltic waves. Okay, now, so first step, that is ingestion of food. How much food we are taking, that is decided by hunger. So hunger means, if we are hungry, we can say that now today I am very much hungry, so I will eat 2 plates of rice. So that is amount of food amount of food which we take, okay, that is decided by hunger, okay. And appetite means which type of food you are seeking for, okay. Means you can see here, suppose if you have two options, you have an apple or you have a piece of cake, then this is your, what is appetizer? That is piece of cake. Suppose if you have, your stomach is full, but still if you have a piece of cake, then you can easily have it, okay, grab it. So this is the type of food a person preferably preferably take or seeks for, that is appetite, okay. So hunger decides amount and appetite decides type of food, okay. So this is first step, that is ingestion of food. Second is chewing, or that is also known as mastication. Now what is mastication or chewing? Okay. Mastication or chewing is the process by which food that is present in the mouth, that is divided into small pieces so that it can be easily mixed with saliva, okay, as well as it can be acted upon by salivary amylase and lingual lipase. And another function of chewing or mastication, that is it can be easily swallowed. So the food which is taken, ingested, that is first broken down into small particles, okay. So that is the process known as mastication or chewing. Fine. Now how this mastication or chewing takes place? We require, first thing, movement of the jaw. You can say we have lower jaw that moves only, this upper jaw is fixed, this lower jaw moves, so movement of jaw. Second, our teeth, they have cutting and grinding action, okay, as well as we have a movement of coordinated movement of tongue, coordinated movement of muscles of oral cavity also. Fine. So this is important for mastication. Now we will discuss the mastication or chewing reflex. Now what is this reflex? If you know that reflex has got 5 components. Which are the components of reflex? If you are talking about any reflex, reflex has got 5 components. One, that is receptor. Second, sensory nerve. Third, center. Fourth, motor nerve. And 5, muscle. So here, what happens when you have food in the mouth? Receptors of the oral cavity are stimulated. They send signals through sensory nerve, okay, to the centers which are present in the brainstem. Then motor nerve, that gives information to the muscles of mastication. But here you can see this is voluntary reflex, not involuntary. Some of the reflexes are involuntary also. So chewing reflex is voluntary. Here what happens? There is movement of jaw, opening and closing of the jaw. This is the reflex. Fine. Okay. Now, so you can see here this chewing reflex, that is also a reflex, but it is voluntary reflex, and the main action required here is opening and closure of the mouth. Fine. Now, so here you can see this muscles, they facilitate opening and closure of the mouth by jaw movement. As well as, very important thing, we require teeth also for chewing. We have different types of teeth, as you know. Incisor, these are incisor. In each jaw we have 8 teeth, if you know that. And 8, 8, 8, 8, 32. Okay, so here you can see which are these 8. The formula you can easily remember: 2, 1, 2, 3. And 3 plus 2, 5, 6, 7, 8. Okay, so here in this jaw, same 8 teeth are there in the lower half, then 8 on the opposite side, upper and lower part. Fine. So now 2 are incisor. Here this 2, first 2, front one, 2 incisor, 1 canine, 2 premolar. These are 3 molar, 2 premolar and 3 molar. Now what is the action of this incisor? Incisors are for cutting. If we want to cut something, we require this incisor teeth, this one. Okay. Then canine. We don't have canine prominent. Canines are prominent in carnivorous animal like in lion and tiger and all, because they have to tear. So tearing action. Then comes molar and premolars. They have grinding action. Fine. So here they are also very important for chewing. Teeth are must for chewing. They apply highest force, you can say here, force exerted by incisor, that is about 55 pound. Okay, and by molars and premolars, that is 4 times more, 200 pounds. 200, not 2000, 200. Fine. So incisors, they apply 55 pound force, and your molars and premolar, they give 200 pound force. Okay. Now we'll discuss muscles of mastication. You can see here we have different muscles. They are important for mastication. We will discuss one by one. Which are the chief muscles of mastication? Just a minute. So first and foremost, this one, temporalis, this one. If you just clench your teeth, you find here prominence. You just can see here. Just clench your teeth like this and put your finger here. You find this temporal region. So these are temporalis. Fine. Next muscle, that is your pterygoid. This one is pterygoid. This one. Pterygoid internals and externals. Okay. And this one is masseter. So you can see in this diagram all the muscles are shown. I'll just show you. You can see here. Temporalis. This is masseter. And these are pterygoids. This is lateral and medial pterygoid. Fine. So these are the muscles for mastication. Fine. Now I'll just show you. Now which nerves they supply these muscles? This is just little bit anatomy, but we will discuss functional part of anatomy. So masseter muscle is most of the muscles are supplied by fifth cranial nerve. Only temporalis is supplied by the seventh one. So easily remember, fifth cranial nerve, if you can remember, fifth cranial nerve has, it is trigeminal nerve. I think you are knowing we have 12 cranial nerves. If you are not knowing, then go to my video. I have shown that 12 cranial nerves, names and their function. From which fifth one, that is trigeminal. Trigeminal means it has 3 divisions. 3. One is ophthalmic, this one here. Second is maxillary. And third is mandibular, like this. So this is trigeminal nerve. Fine. So here mandibular branch of the, so ophthalmic, maxillary, mandibular. So mandibular branch of fifth cranial nerve supplies your masseter muscle. What is the function of this masseter? I will just show you masseter. Where is it? Here. Okay. So what is the function? It raises the mandible. Mandible is raised. And therefore what happens when mandible rises up? Clenching of the teeth. Okay. Also it helps to protract the mandible. Mandible gets protracted. Forward movement. Okay. Temporalis is also here. This one is also supplied by mandibular as well as maxillary branch of the fifth cranial nerve. Its function is it also raises the mandible, and here not protract, it retracts the mandible. Protrusion and retraction, like this, forward and backward movement. Backward is by temporalis, retraction. Fine. Then we come to pterygoid muscle. Okay. Pterygoid muscle also supplied by fifth cranial nerve. Only buccinator is supplied by seventh one. So pterygoid muscle, it protrudes the mandible, it depresses the chin, and because of depression of the chin, your mouth gets opened up. So this opening and closing of the mouth, that is important for chewing, for grinding movement. Okay. Then buccinator, this is not the basic muscle, this is an accessory muscle for mastication. But buccinator is important because this is buccal cavity. It prevents the accumulation of food in the buccal cavity, means between teeth and cheek. And when there is palsy of the facial nerve, that is known as Bell's palsy. You will learn later on in Bell's palsy what happens is buccinator gets paralyzed. So food gets accumulated when person tries to swallow. He or she cannot swallow food. Fine. Now, innervation means nerve supply. So most of the muscles of mastication we have discussed, they are supplied by trigeminal nerve, fifth cranial nerve. Fine. Okay. Then nucleus of this fifth cranial nerve that is present, you can see here, this is the trigeminal nerve. You can see here trigeminal nerve, and the nucleus is present in the brain stem. Okay. And stimulation of, when we are stimulating the reticular formation areas in the brain stem, test sensor centers, they cause this rhythmic chewing movement, as well as if there is stimulation of the areas of hypothalamus, amygdala, and cerebral cortex near the sensory area for the test. Okay, that also cause the movement like chewing. Okay, so this is your chewing reflex, which is important. Now, what are the functions of mastication? As I told you, benefits of mastication or chewing. Okay, or mastication. One, that is, it breaks down the food into small pieces. So what happens? Surface area of the food increases. Okay, so digestion is easy. Okay, second thing, because of chewing, if there is cellulose membrane that is present sometimes around the raw vegetables, fruits, we have cellulose membrane. We don't have. Animals can digest that cellulose because animals, they have enzyme cellulase. We don't have this enzyme cellulase, so we cannot digest it. So if we chew, we are just breaking the cellulose. Okay, so it is broken down. So that is second benefit. First, food is broken down. Second, cellulose is removed. Third, that saliva gets mixed. So what happens? Your salivary amylase, that is important for the digestion of starch. Starch is converted into maltose and dextrine. That is, we will discuss in detail. So this is also acted upon. Okay, and lingual lipase, that is also lipid splitting enzyme that is secreted. Fine. Another, when there is chewing, swallowing becomes easy. After you chew, you are converting it into a small bolus, so it can be easily swallowed. Suppose if you are not chewing properly, like suppose if you have a big medicine, it becomes difficult for you to swallow. So chewing makes the bolus into soft form, so it can be easily swallowed. Okay. Another important function of chewing is we are stimulating taste receptors, because of chewing. You can say that this food, suppose this is the tongue, so food particles, they get spread over the taste receptors present in the papillae of the tongue. Okay, so we feel taste. If we are not chewing, we are not getting taste. This is the reason we swallow medicine without chewing. Otherwise, what happens? We feel bitter taste, and we don't like to take the medicine. Fine. So these are the benefits of chewing. Okay. So today we have started this topic, introduction and mastication. Tomorrow we will start with the saliva, lubrication of food by saliva. We will discuss different salivary glands. We will discuss about their secretion, about their functions. Okay. So today I am ending here with this introductory part. I am not going in detail of this salivary secretion. We will discuss tomorrow. Again, for all my students, that if you wish to get soft copies of all my notes, download the app Vesalius and can purchase the book Physiology Notes also. Thank you, Ali. Thanks for watching me, all of you. Thank you so much. Okay, if you like my video, you can like it, you can share with all your friends. Ali, that is your responsibility. Okay, my videos, please share with all your friends. Fine. Tomorrow we will continue with the saliva, salivary secretion, phases of salivary secretion, and functions of saliva. Okay, thank you so much. If you like my video, like it, share with all your friends, subscribe my channel, and hit the bell.